Hello everyone, I am Dr. Sunil Kar, Director of 3S Dental Care. Then there is a separate topic of discussion for diabetic patients and cardiac patients because we have to take extra care for them and we have to give extra instructions to them also. Implants means suppose there is a missing teeth and we want to replace it with a permanent solution, that is a titanium screw, that is grade 5 titanium. This is the implant which we can place in the missing teeth area, and after that we have to wait for a period of 3 to 6 months. Then after that we can place the second part, that is known as abutment. After placing the abutment we can place the crown. So this is how we are going to replace a missing teeth with a titanium screw, that is known as implant. This is in short. Normally when we plan for an implant, we have to check the bone quality of the patient, age of the patient, whether the patient is under any medications or not. After checking all these, we have to take a full mouth X-ray, OPG, or we have to go with the CBCT. If we are finding everything perfect, then we have to select the proper implant angulation. We can use guides or stent for that. After selecting the implant angulation and all, we have to select the implant size, proper diameter of the implant, proper length of the implant. After selecting the proper length and diameter of the implant, we have to place the implant in proper place, that is according to the guidelines. We have to place the implant into the proper place, and after that we have to give proper medications to the patient so that proper healing will be there. Then proper waiting time is there according to the bone quality and oral hygiene of the patients. And then we have to check the habits of the patient also. If the patient is having some tobacco chewing habit or smoking habit, then we have to instruct the patient that strictly they have to use the mouthwash properly, regularly, and if any kind of infection is there in between, they have to use antibiotics in between also, and proper maintenance is mandatory for the patients with any kind of habit. And after placement of the implant, we have to wait for 3 to 4 months or 6 months maximum, then we can place the crown. We can select the crown like zirconia crown, PFM crown, that is porcelain fused to metal, or gold crown also, or titanium crowns also. The best part is weight of the crown. Gold has the least weight and titanium also has the least weight. There is also again a different type of crown known as DMLS crown, that is direct metal laser sintered, which is also made up of metal only. It can be of titanium, it can be of cobalt chromium, but the technique of manufacturing is different. The technique of manufacturing of all zirconia crowns are also different. So the technique of manufacturing also depends, makes the crown rate successful. There is nowadays most common monolithic crowns and CAD-CAM crowns. CAD-CAM crowns are the most commonly used right now because of their most precision and perfect fit. And right now there is digital crowns. We are scanning the tooth and we are going for digital crowns. The fit and precision of the digital crowns, the perfect occlusion and the marginal fit of the digital crowns are best. If you are using titanium or gold or any material, irrespective of that, the digital crown is a different technology which is used right now. Now this is normal teeth. We can see the bones surrounding the teeth. This is a cross section of the teeth. The bone surrounding the teeth is perfect. The occlusion, if we see the bite of the teeth, or the occlusion surface or the upper surface of the teeth, there are small intricacies that is known as grooves. The grooves are there naturally made, the anatomical grooves are there naturally made in the teeth for proper biting. What happens is, if the patient doesn't clean or patient has some sticky food or carbohydrate nature of food or any kind of chocolates or any sticky biscuits or something, there is always a chance that food particle gets stuck in these grooves. So what will happen if the patient is not maintaining proper oral hygiene? What will happen is there will be some small cavities developed or black spots will be developed. If the patient is neglecting those black spots and not maintaining those black spots properly, then what will happen is those black spots will convert to caries. This is caries, dental caries. Then this caries, if also the patient is neglecting, or if the patient is not going to a dentist and going for an early filling, if the patient is not going for that, then the caries will increase to the pulp. It will go to the pulp of the tooth. Then the patient has to go for root canal treatment. Then the patient has to place a crown. If the patient is still neglecting, then the patient might have to extract the teeth. So this is how a small black spot may turn into a big cavity may turn into an infection, and the infection may turn into a extraction. So maintenance and regular visit to a dentist, even if you see a small black spot, is very important. So this is how a small black spot can turn into a big caries or a root canal treated teeth.